We're going to talk about all things hair. How does hair loss happen? Hi, and welcome back to the Beauty in Bloom podcast. I'm Jason Bloom, a facial plastic surgeon, and I'm joined as always by my fantastic nurses here. We have Simona Talma, we have Sarah Hawkins, and we have Lilly Marquez. Welcome back to our podcast.
Thank you.
So this podcast is actually, I will say, near and dear to my heart, and we're going to talk about all things hair. At the end, towards the end, we'll talk a little bit about my personal journey with hair loss and my hair transplant and how we did it and what I went through. But this is, it's interesting to us because it's a topic that we don't get to see a lot because 80% of our patients in this office are actually women. And while women do experience hair loss, which we'll talk about, hair loss in general is largely and predominantly a male issue, right? So most of the patients that we're treating in our office are men. And let's start from the beginning. One of the questions is, how does hair loss happen? Well, there's a number of different things that can happen. It can be genetic, right? We talk about male pattern baldness, and they used to say that, if it's your mother's father, whatever that person looks like, that's what you're destined for. That's not necessarily the truth, but, it can be genetic. Stress, a huge part of hair loss, and we'll talk about how that plays into it. We did a podcast episode all about the medication-driven weight loss, and certainly we're seeing, that kind of goes in the stress component because you're stressing the hair, but that can definitely cause hair loss. One of the biggest issues, hormonal, right? So testosterone and both the female hormones and the male hormones affecting the hair can cause hair loss. But when we think about the hair, like the hair follicle and the hair cycle, it's called, there are two main phases that we think about. The first is called anagen. And anagen's the growing cycle. And that is when the hair follicle is actually growing and causing the hairs to grow in the scalp. The other is telogen, and telogen is the resting phase. And usually it's like a sleeping or resting phase. Both of those phases last about 6 months each, and there are certain things that can lengthen or shorten each of those cycles. So certainly if you have a stressful couple months, that can lengthen that 6-month telogen cycle and cause a longer period of hair loss. So a lot of what we're doing, certainly on the non-surgical side, helps to, transition the telogen hairs to more of a growing or anagen phase. And then there is, in relation to some of the, let's say, hormonal mediation, men and women in general tend to lose hair in different ways. Men, we get that male pattern baldness, right? What happens is this hair, up until you can feel in the back of your head, there's like a little bump there. The hair here coming back is actually subject to hormonal mediation. The hair around the sides and in the back, low, you're never really going to lose that hair. So the hormones aren't subject to that. Women in general tend to lose hair a little bit different. Women tend to thin, and then their part tends to widen. Yeah. Those are some of the two biggest things we see, from the gender differences in hair loss. But let's get into it a little bit, and let's talk about some of the treatments that we do. I'll say hair. Let's talk about non-surgical hair restoration. And Sarah, you probably do the most of this in our office. Tell me, first of all, from a topical standpoint, what's out there on the market? Like, what can men and women use topically for their hair?
Women can use the men's Rogaine. It's just marketing that we have all these different kinds of Rogaine, but we know Rogaine works.
Right. Rogaine is minoxidil.
Yes.
That's the active ingredient. And, like 5% is probably, that's the most active dosing out there, or 5% minoxidil in the Rogaine, and it's topical. You might find it's like a foam. Yeah. I've used that before. It's like a foam that looks like kind of like a mousse. You spray in your hand.
Yeah, like shaving cream.
Exactly.
Sort of,
it's like a shaving cream, and you kind of work it through your scalp. So certainly that's out there. What are some of the other things that we're seeing?
So, well, now we have therapy, which is wonderful. You don't have to worry about the icky gickiness of the foam minoxidil. Your wonderful hairline.
Yeah, so I have a hair care line, right? And
smells amazing.
It does smell pretty good. Yeah. So I've helped to create it and formulate it over 5 years ago. We actually give it to all of the patients in our office that are getting non-surgical or surgical hair restoration. And we have a shampoo and conditioner, and then a serum, and different kinds of serums. There's different companies that make them. The nice thing about our serum is, we ask patients this question. We say, what's your skin type? And we say, do you have normal skin? Do you have sensitive? Or do you have oily? Really normal to dry, oily, or sensitive. And they're like, well, no, not my skin. I'm talking about my scalp, my hair. Well, does your skin stop at your hairline?
Right.
No. Right.
Yeah.
If you have oily skin, guess what? You have oily scalp.
Yeah.
I mean, that's true. So all of our serums, which have our natural ingredients, all natural ingredients, have a high concentration of what we call BioAdapt 8, which is our proprietary blend of ingredients that you can use as a scalp serum. And then we have a shampoo and conditioner that's safe for color-treated hair. It's safe for hair transplanted hair, and we give that to patients. That's been really successful. We love that. But those are good topically.
What inspired you to create the line?
Well,
was it that you didn't like anything on the market that?
Yeah, I mean, there wasn't anything that kind of bridged this idea of like, you could use it in a salon and you could use it in a doctor's office. And that's one of the that's like really one of the beautiful things of Therapy Hair Care is that we sell it at salons. Like Sally Hirschberger's salon in New York and LA is like, they love this. I was just out in LA and we did an event with some of their celebrity stylists. They love this. They give it to their clients. We sell it in our office, So it's like safe enough for transplanted hair, but works well enough that we have, salon sales with this.
Yeah, it's amazing.
But the thing that inspired me was my own personal hair loss story. So I had some connections of friends that were in the hair care industry and in the salon industry. And that really, those connections allowed me to kind of seek out some, some companies to actually help formulate this. Besides the topicals that we put on our hair, medicinally, Lily, what are some of the options out there? Let's say, we know that topicals aren't that well tolerated, meaning like it's hard to get someone to put a foam or a serum on their head every day. But honestly, taking a pill is easy. So what are some of the pills out there for men, for women?
I think one of the big ones, it's Nutrafol. We actually used to carry that. I don't even know if it's still out there, Viviscal. And then now we carry the gummies Extresse.
Yeah, so
Extresse
Extresse is like
Yeah.
these are the hair nutraceuticals, we'll
Yes.
say. You know,
Supplements,
nutraceuticals are
yeah.
like
Yeah.
supplements or vitamins, right?
Yeah.
Have you taken like I used to take the Nutrafol. It was like
4 big
Yeah,
pills.
horse pills.
huge horse pills. They were
Yeah.
like, I'm like, oh my God, I have to choke this down for
Yeah.
these pills
And patients
every day.
would forget because they would try to split it up.
Oh my
so they would do the
gosh.
morning and then they would forget the night. So they were underdosing themselves, I guess you would say.
It was crazy.
Yeah, the gummies are great. I've been taking them. I personally think they taste great.
Yeah,
I think they taste good. You only have to take 2 of them. And I feel that they really work.
Yeah, there's
Yeah.
no sugar in them. I think they use like
Stevia
Splenda.
or-
Yeah, I think it's like
and
stevia or something. Yeah.
they taste really good. You take 2 strawberry
Tastes like
gummies a day.
yeah.
Yeah, it's like a
and,
fruit
treat
gummy.
as opposed
Yeah.
to a chore.
Yeah,
It
and,
is.
and it was actually developed by dermatologists. I'm friends with one of the guys who helped develop it, and we've been using it in our office. It's been pretty effective and,
Yeah.
and easy to take with patients.
You know they're going to follow the protocol. Like, hey, take these 2 gummies like in the morning.
Right.
Use your therapy. It's kind of a no-brainer. People wash their hair
Yeah.
and they like, sweet treats.
Yeah, but medication-wise,
Yeah,
Simone, tell me about like.
I think a big one is the propecia. I
Right.
know quite a few males that are on it. I know it's intended to basically stop the hair loss, but at least, speaking on the men that I know, it actually, their hair grew back. For the most part. And so I've been very impressed with it. I know men get a little nervous about the medication because one of the side effects is
Erectile dysfunction.
Thank you, erectile dysfunction.
Finasteride.
Yeah,
Propecia.
Yeah.
Which is, also finasteride.
I mean, I've not had that problem with the men that have been on it.
But I will
Anyway.
say, I've
No,
never
I've not had
taken,
any issues.
Propecia or finasteride. I have been worried about that, and so that has kind
It's
of like
rare, though.
It is rare, but like it's not something I want to.
yeah, and I've
play
seen
around
a lot
with.
of
All right,
patients
fair
for
enough.
hair who have said they tried it and it's
Yeah.
Yeah, and
It's no
so that
bueno.
has never been for me. I have never been on that medicine, and that has worried me. So certainly, and if you're a woman of childbearing age,
Yeah.
you definitely don't even want to touch that medicine.
Yeah.
I didn't think it was for women.
Well, it's not.
No,
But
but
you
like,
Oh, but
like
you
put
mean
it
if a
on-
man is
Yeah.
on it?
Yes.
Okay.
like, you
okay.
don't even want it to come in contact with your skin.
Yeah.
Yes.
Oh,
so
God.
yeah.
I did not know that.
Finasteride is actually very dangerous for women because there's like birth issues
birth
with the
defects.
birth defects with the children. So
Okay.
you don't want even to touch those pills.
Mm-hmm.
But interestingly, what I have taken personally, and I will say, other than my hair transplant, which is now I'm about a year and a half. It was about a year and a half ago. The one thing that I think that made the biggest difference in my hair, and I will say just like the thickness of my hair, was really oral minoxidil. So we talked about Rogaine, which is topical minoxidil, but the dermatologic literature out there is actually really strong for oral minoxidil. And so men can take up to 5 milligrams a day. I take 2.5 milligrams. Women can also take somewhere between 1.25 to 2.5 milligrams a day. It's easy. It's a small pill. I take it every day. I've noticed a huge difference in my hair thickness with oral minoxidil.
A lot of people say that.
Now, with women, though, would you see an increase in hair growth all over your body?
Yes,
You
that's
can.
Yeah.
You can
Okay.
get some hair growth like on
Because I know that's the first thing that a patient would ask is
some fuzz on your
Yeah.
face.
Come in
or-
for
It's not.
dermaplane.
It's not making new hair grow.
Yeah.
It's just
Right.
making
Your hair
whatever
grow
hair
long-
you
quicker.
currently have more apparent.
Yeah.
Yes.
Okay.
Absolutely.
Okay.
And when you stop the medication, hair loss continues. It's something that it is going to be like a lifelong thing.
Totally. But if it's keeping my hair like
Yeah.
it is, like I'm on it.
What are
You
the
know?
side effects?
Minoxidil, there are when you take it, you can have a little bit of like edema or swelling. It's a blood pressure medicine,
Okay.
so it lowers your blood pressure.
Yeah. So
Yeah,
Some
so-
people feel dizzy.
Yeah,
taking
I
Minoxidil.
tell patients if you're on blood pressure medicine, or I like to have their doctor know about any new medicines that are like, especially when it's a heart medicine, a blood pressure medicine. I say, talk to your doctor about this. If it's right for you, they'll prescribe it. But I let them know that this is definitely an option, and there is really good data out there on oral minoxidil. But like, what are some of the things we do in our office? Like, so. Tell me about like PRP, Sarah. You do a lot of PRF. Why would someone do PRF? With microneedling or PRP or exosomes microneedled into the scalp. What are some options to help with hair growth? What are you doing? How many treatments? Tell me about that.
So when patients come in interested in some kind of hair rejuvenation, I tell them we have two options in our office, and there's two options really no matter what office you go to. You have PRP or PRF, and then you have a hair transplant. I mean, there's not really anything in the middle, unfortunately.
Right. It's like two speeds.
Yeah.
Right. Yeah. Full send
Yeah.
or let's take a year to get you kind of to a better place. But we do PRF, of course, in our office. I have had experience with PRP too. I mean, the key differences between PRP and PRF are PRP, you're exposed to hours of growth factor once it's injected, whereas PRF, you're getting a couple days. Now, no one can definitively tell us based off of the clinical studies that have been done how many hours or how many days, but we know that you're getting exposed to more growth factor from the PRF.
So you're saying that it's more of like a delayed release
Yeah.
of
Extended
these-
release,
Slow
yeah.
release, yep.
It's more of an extended release of the growth factors, the important things that are going to help those hair follicles, right?
Yep.
Right. And with PRP, you have an added anticoagulant, whereas with PRF, it's only your own body's material. So
Yep,
a lot
100%
of
natural.
yeah, a lot of
100%, yeah.
people like that. A lot of people say, "Oh, that's great. I don't want to be injected with an anticoagulant." I have heard that the anticoagulant can degrade the PRP. I've never actually seen that studied. But I mean, both work well. PRP works well. PRF is just a little bit better.
So, like Lily, what are some of who's like a good candidate for injecting or microneedling some of these products to like non-surgical hair rejuvenation?
I would say a patient that's just starting to like experience think like a male patient, like the male pattern, like baldness. Just, I guess you would say somebody that's not a neograft candidate. Or like for women, I know like women in this office that had, their part was like a little bit thinning postpartum, someone that, you need to stimulate that hair growth. But I guess it would just be somebody that's not a neograft candidate with just like a little bit of thinning. Anybody more that needs more than that, they would just be unhappy with the results of the PRP.
Yeah, and also that also goes for some of the younger patients.
Yes.
Yeah, I
right.
was just going to say, there's a lot of young men who come in this office who are not old enough
Right.
for neograft yet.
I mean,
And
we usually say that you should be around 30 because what happens is then the majority of your hair loss has already happened.
right.
And then even though I feel like
Damn, that's
kind of
young.
I feel like I lost.
I was gonna say, is that true? Like by your mid 30s, like yours.
Well, I mean, they're going to
gonna-
progress more
Yeah.
after 30, but we don't like to do a true hair transplant in a patient younger than 30 years
Okay.
old. There are some exceptions. Somebody that wants one now to look better, feel better about their hairline, and then but they know they might need something in the
Yeah.
future, more to give them more density because they might have future loss.
Yes, yeah.
So a younger patient that comes in might be a good candidate for some of these non-surgical options.
Yeah.
And what are you doing? PRP injections? Like how I do it is I'll do a series of 3 a month apart, and then I start to space it out every 2 to 3 months just to kind of keep that stimulation of hair follicles. Is that what you do? Do you have a different kind of plan?
I do 3 treatments 6 to 8 weeks apart, and then they can come back as early as 3 months for maintenance. They can do 6 months. They can do 12. It kind of just depends on the person, what's causing their hair loss. I treated a lot of people for hair loss after COVID, and I just got them through that kind of that
initial stage.
Yeah, that basically I got them back to a good place, and then majority of them didn't even need maintenance after that. It was just managing the stress.
That's the frustrating thing about like all of these different options that we have. It's like a lifelong thing. Yes, do PRP injections. There are studies, they show it really works. But if you stop doing the PRP injections, you're going to have hair loss. And that's where obviously the hair transplant is different.
It's interesting though. I like what Sarah was saying because, so let's say they, like during COVID, the stress of that virus or the virus itself was causing hair loss. That's what we call telogen effluvium. That term, it means stress loss of the hair. And it's like actually shocking the hair follicles and putting them into more of that resting phase.
And it's typically you start to see that hair loss around 3 months after a traumatic event or a stressful event.
Exactly.
So same thing with the weight loss medications when people are
correct.
Right. So once you get them out of that telogen phase and more into that anagen phase, then they're back to growing their hair normally. But using some of these non-surgical treatments like PRF, will help them,
boost them back
kind of
into
shorten the telogen phase and increase the anagen phase and get them reverted back to more of the growing phase. Yeah. So, that's interesting. Like we have options for, different patients based on, their stage of life, how bad it's bothering them. Do they want, the downtime they have? Do they want to undergo a surgical procedure?
Their financial means.
Yes, exactly. There are so many different options, and I'll tell you, people will do a lot to make sure that their hair is maintained.
It's a big deal.
Certainly men. This is like one of the few things that men are really bothered by. Yeah.
Yeah, I mean, it gives you so much confidence having a full head of hair.
A good flow.
Yeah.
Yeah.
I'm
You have
trying
great flow.
to improve my flow.
I saw a picture of you. I don't know. I think I was like stalking your Instagram, and I saw a picture of you, him, and Julie in Vegas. And I could not believe the difference. I looked, I was like, I didn't even realize.
3 years ago, probably.
Yeah, but it never seemed bad. It
I
never
agree.
seemed bad to me. And then, I don't want to say it was bad, but when I looked at the picture, I was shocked at how thin it looked. And there was
when
like
you
lights.
would be bent over like this, you would really notice it.
That's what
through
did
the
it for
top.
me.
Yeah.
I did a lot of like training, and I still do like a lot of like injectable training and things. And with those lights, and I would look.
Yeah. It was like at nighttime, and the lights just like lit up. Yeah.
I would look at pictures of myself afterwards. I'm like, oh my gosh, I really need to do something about that. And I think that was what galvanized me to do this. And let's get into it. Let's talk a little bit about some of the options for hair restoration and what I did. I remember exactly. I was actually scheduled to speak at one of the facial plastics meetings, and it was in April. And so when I knew I was scheduled to do that, I booked that time out of the office. The meeting was from like a Thursday through Sunday. And so I was out of the office in the operating room on Thursday and Friday. And the meeting designer, the meeting chairperson called me and said, "Hey, Bloom, what are you going to talk about? I have you down here that you're giving some talks, but you haven't submitted any talks." And I'm like, I don't know. This was like in January for like April, and I was like, I don't know if I'm going to be able to make it. There's just so many things going on. And then I was like, you know what? I've always wanted to do this. I'm booked out of my office, so I don't have patience right then. I was like, why don't I just do it when I was supposed to be at this meeting. So I said, I'm going to kindly decline the invitation to give talks at this meeting. And I'm like, I'm going to get my hair done. And so that was what really, that's really what did it for me.
I'm going to have a me day.
Yeah, exactly. I mean,
It was
very
a full me day.
Yeah.
infrequently do I take time to do something like this for myself.
I was shocked when I actually saw you on the schedule. I was like, there's no way.
I've never had like a surgical procedure like this, like, other plastic surgery. But this was something I was like, and I wanted to like improve, like, I really wanted to grow and improve this in our office and offer it to other patients. And it's like, hey, I'm not only the hair club president, but I'm also a client.
Yeah.
And that's always been, my feeling. If it's good enough for my patients, it's got to be good enough for me.
Walking billboard.
So, let's talk a little bit about hair restoration. In general, there are two main types of surgical hair restoration. What we call is follicular unit transfer, or FUT, which is kind of like the older technique, and FUE, which is follicular unit extraction. So what they used to do for an FUT, which is commonly known as like the strip method, they would shave a small portion of the hair down and actually make an incision in the back of your head. It was like kind of like a happy face, but from ear to ear, and pull out this strip of hair, right? And then they would close it with stitches. So the good thing was it was only a small amount of, scalp that was taken. The downside was you would have a scar that was about this long from ear to ear, and you couldn't really wear your hair cropped. One of the groups that does well, I think, still with an FUT or follicular unit transfer is, so they would take this strip out and they would pluck the individual hair follicles out of this strip and cut it up on the back table, right? One of the groups who still does well with this is actually women.
Yeah.
Because you don't have to shave
your head.
down
Yeah.
like a huge area. And like you could take a clip and flip this up and flip this down, take that strip out, and women tend to wear their hair less cropped in the back. They could do this. Now, yes, you'll have a scar there.
Isn't it painful?
It's not because you're numbed up.
Well, no, I mean after though, like the recovery.
It's
like
not.
you're gonna be sore regardless.
Yeah,
feels
I mean,
like
I
it's
didn't,
sore.
I didn't necessarily have that. I mean,
Okay.
so I didn't have that technique, but I think women are one of the few groups that do well with the FUT method. What I had is FUE, follicular unit extraction. Now, what you have to do is shave the back of the head. It's down to like a 0. And then each individual hair follicle is grafted. There's like a 1 millimeter punch that takes out each individual follicle. And the follicles have either 1, 2, or 3 hairs. Now, when you're reconstructing the hairline, the closest to the hairline, you want to put the 1s, because that's, if you look up close, that's the most natural, with like the 1s coming out of that. Behind that, you can put some of the 2s, and behind that, to fill in maybe like the crown or the vertex area, the 3s. But this is done individual 1 millimeter punches. The good thing, though, is that you never have a scar. It's like totally scarless, and these individual punches, within a week, I was back to like, you couldn't even really tell, other than I had like a little bit of a funky haircut.
Yeah,
but
it had to kind of blend back together.
I mean, but I will tell you, I had this done on a Thursday. I was back seeing patients in the office on Monday. I was back in the operating room on Tuesday. And, the worst parts of it is that, yes, I had like a little, you have to like wash your hair like this.
Yeah, you don't want direct
Yeah,
water
you don't want to
pressure
like
on
go
your scalp.
underneath the
shower head.
the shower head. But, I was washing it with like a red Solo
How long do
cup
you have to do that for?
For about 2 weeks.
Okay.
But let me tell you, after 2 weeks, that shower was like the
Amazing.
Heaven.
best.
Yeah.
And like, you just run your hair,
Yeah.
your hands through it. It was fantastic.
Yeah.
I will say, and that's called neograft, is that the FUE technique or neograft is by far that is really the number one treatment for surgical hair restoration that we do in our office. Now, recently, and I will say recently, like the beginning of the year, kind of in March, we did get the most like advanced FUE treatment out there, and that is what's called ARTAS. ARTAS is a robotic hair restoration.
What's the robot's name?
I think it's Harry.
I was going to say, have we not named him?
No, we did, and I think it's Harry.
Yeah, that makes
I mean, it makes sense.
Yeah.
I mean,
Harry.
yeah, it's a pun.
oh, Harry.
Yes,
Okay.
it's punny, as you would say.
Yeah.
But yeah, so the robot uses AI to like actually scan the actually donor area, and it makes the individual punches with the robotic arm, and then afterwards it will scan the donor area and it will punch and make the donor sites.
You mean the transfer site?
Yeah, make the sites that you're going to transfer it to.
So you still need that human that's then going to be transferring.
Exactly.
Okay.
So the human actually picks the hair. They punch the hole, but it stays there.
Okay.
Yeah.
So that's one difference also between the ARTAS and the neograft. So neograft, the punch is made and then it sucks it into a container.
Okay.
Right. So there's not a lot of hands-on, which is good. You don't want to like play with the grafts a lot. You want to kind of like be hands off. And then we have a tech who sorts them into the 1s, 2s, and 3s. The ARTAS robot is different. It punches it and leaves it in the scalp, and then we have a tech actually removes them from the scalp. Okay? The ARTAS then makes the sites, and with it kind of punches the sites, and then we individually place the grafts ourselves. Now, the crazy thing is, it will measure like the exit angle of the hair. Like it scans the scalp like 10 times faster, even more than that, than like a human eye can.
Yeah.
And it calculates the exit angle of the hair and the angle that it has to punch to get the hair out. And then also try like a human hand making those
Yeah.
recipient sites. Like I had 2,600 grafts.
Jeez.
Try to do that 2,600
Yeah,
times at exactly the right angles. This robot is able to do that pretty much precisely on its own.
I mean, that's incredible. Harry sounds wonderful. There's obviously a reason why we're still doing neograft. So who's, I guess, not a candidate for Mr. Harry?
Yeah, so the one of the issues is that you have to really shave the whole head down
For
in
the
order
robot to
to
be able
get
to
the
see
robot.
it.
So
Okay.
women, it
Exactly.
would be a tough one.
Yes, it has to see the donor site. It has to see the recipient site. Now, it works great. Like I said, though, we do about probably 75% neograft in our office and about 25% ARTAS.
I do think that those numbers will change too
yeah.
as time goes on.
Yeah, he's new.
Yeah, I mean, I think the nice thing is once you have the technology, there's a lot of just like software updates eventually, and they're just completing this. They'll be able to not only make the recipient site, but actually place the graft at the same time.
Yeah,
That's amazing.
Which will be really neat. And then, to be able to update that software as it comes out, I think is really important to know.
Do you feel like patients are saying no to the ARTAS because they have to shave their heads?
I mean, I think that's probably the biggest pushback. It is certainly a little bit more expensive.
Yeah.
The pricing is based on the number of grafts that you do. So
Yeah.
the more grafts, we tend to bring the price down, obviously.
graft,
Yeah.
Per graft.
Yeah.
But the ARTAS, although it's robotic, we still need like we have like basically 3 techs there. We have someone who's placing the frame that, you know, stabilizes the head, someone that's actually counting and dividing the grafts, and someone, like I said, to pull the grafts out of the scalp. So we still have like basically 3 people. I will say the ARTAS is a little bit quicker.
I was going to say, like, what's the difference? You had 2,600 grafts, you
I
said?
mean, it took about 10 hours.
Yeah,
And what would
that's a
that be
really
if you had
long
gone with
time.
the robots?
I mean, for me, if I lay flat for more than 8 hours, like my back is destroyed.
Yeah, I mean,
And you're laying on your
I will say that
stomach,
was
right?
the one I didn't feel anything. So I took like an MKO melt, which was like I mean, it was nice. It's like we give that to patients.
Valium,
if I'm doing,
ketamine, and Zofran.
Yeah, I mean, yeah. So midazolam, ketamine, and ondansetron or Zofran, and it's great. It's like a little lozenge. We give it to patients who we do upper eyelid surgery on in the office.
They kick in quick, but they also, I mean, they're not going to last you 10 hours.
Yeah. I mean, what I say is, but like, I'm a lightweight, so I had one of these, and I just put in some AirPods. I was listening to some music. I fell asleep. That was like in the morning, and then, so that's when they do the harvest. So you're laying face down.
That's what I thought.
For
Okay,
a couple
yeah.
hours while they do while we do the harvesting. And then the afternoon, you're like, you know, we go to the bathroom, you have lunch, and then you're sitting kind of like in a beach chair like this.
Okay.
And then I had another one of those, and I just kind of zoned out while the placing is going.
Did you feel that? Or was
I
it like
didn't,
a weird
'cause
pressure?
you're
or no?
numbed
Yeah,
up.
you're
Okay.
blocked.
I didn't feel that at all.
Okay.
I say the only other thing that I took was one of our techs were like, "Are you comfortable?" And I was like, "I'm okay." Like I wasn't having pain, but I could feel it a little bit.
Yeah.
And she's like, "Why don't you?" And I took a Percocet.
Okay.
Because the part that was starting to wake up was the donor site,
Yeah.
Yeah.
and that was starting to burn a little bit, and she could tell because I was starting to bleed a little bit more.
Okay.
And so I took the Percocet. I felt great.
Yeah.
I literally took one Percocet that night to help me get to sleep. No more pain medicine. It was, I didn't really feel it at all.
Okay.
And so I was just like pretty chill during the whole thing. And it was super easy. Like I said, sitting in the same place.
Yeah, that
was
to me would be
probably
the
the
hardest
worst thing.
thing.
I started to
Yeah.
feel it
Yeah.
a little bit in my
Yeah.
back.
Do you have
Probably
to
get
sleep a
antsy.
certain way or wear something on your
You
head?
know, we have these little neck pillows that we give to patients. Like, you don't want to sleep on the grafts, and you wear kind of like a dressing for the first 48 hours,
Okay.
and you just have some swelling.
Yeah.
I tell patients, if you're going to have one of these procedures, either neograft or ARTAS, like, you're going to own it for the first week.
Yeah.
You know,
Yeah.
it's like, don't expect that people are not going to know at all. Like, you're going to own it a little
Yeah.
bit. And I did. I mean, but I mean, it was, I will say, this was the best thing I've ever done for myself. My hair looks great. I know that it's going to be there basically forever.
So I have a question because I
Yes.
just had a male patient that I was seeing for Botox, and he was inquiring about doing a hair transplant, and he is thinning up at the front, and he said, okay, I'm game for this, but are they able to do grafts throughout my entire head? Because I'm worried that in 10 years, maybe I'm starting to have more hair loss at the crown, which I don't have right now. And I don't want to have to come back in 10 years and do another graft. I didn't know the answer.
Yeah. So what I tell patients is when I describe like how hair transplantation works, I say that the signal or the message for hair growth lies in the follicle. So the hair back here, like we said at the beginning of the episode, right? The hair back here is not subject to hormonal mediation. So if you take the individual hair follicle unit from here and transplant it here, it grows like this hair, not like this. So you will never lose the transplanted hairs. You can lose other hair, right? But in general, what we do in our office is safely max 3,000 grafts at one sitting.
Okay.
So I always tell patients, focus on the hairline because that's what people see. Make that good, and then maybe in a year or 2 or 5, you'll want to come in and just, touch up some of the areas in the back. And, maybe you'll do the crown area. It doesn't all have to be done at the same time, but it's just a matter of how many grafts we're doing.
Okay.
Yeah.
Yeah, so 3,000 is the max.
3,000 is usual max. And in general, most patients are getting somewhere between 2,000 to 2,500 grafts is a good hair restoration that is able to work on the frontal hairline and some of the volume in this area. And that's what I did. I really didn't move my hairline down a ton.
No, that's, I think, a dead giveaway.
Yeah, but
But your hairline was intact. I feel like it was more like the.
Yeah, I wasn't getting a
thinning.
lot of recession. I was getting more thinning.
Yeah.
And so we focused more about just giving me the density.
Yeah.
And I maybe brought my hairline down a half a centimeter or so.
Yeah.
So you said the neograft was about 10 hours for you for 2,600 grafts. You said the robot's more expensive. So how many hours is it cutting off to, I guess, for the patient to say it's
probably about
worthwhile?
6 hours.
Okay.
Yeah. I mean, it works really quickly. It's just more
Would you
efficient.
argue that you would get better results as well using the robot?
I mean, I don't know.
Okay.
I mean, no one's, I don't think we've ever done a study that I know of. I don't think there's ever been a head-to-head study looking at, neograft versus ARTAS results. People like this idea of the robot because there's less human error in it, which I agree. You're making exact angle, 2,600 times. The robot is making that insertion so it knows the direct angle that it wants to go. And the human hand can't necessarily do that. Now, our techs have been doing it for 18 years,
Yeah.
7
Yeah,
days a week.
let's also tell everyone the tech that we use
they're amazing.
trains
Yeah.
all
Yeah.
the other
Yeah,
neograft
she's one
techs.
of.
She's
she's
incredible.
amazing, and
We fly her in.
Yeah, we fly her in, and she's been doing it for literally 18 years, and she
she's
did
great.
mine. She did the former
awesome.
CEO of the company's hair. She's done a bunch of my friends. So, I trust
Yeah.
her. She did great. She knows what's going on.
Are there any contraindications to getting a hair graft?
I mean, certain kind of autoimmune hair diseases.
Okay.
We have transplanted people with psoriasis and scalp, issues, but obviously active infection in the area. Autoimmune hair diseases and things like that.
Okay. Not an autoimmune disease specifically. It has to be more related to hair.
Yeah.
Okay.
And like I said, I a friend of mine has psoriasis and he gets, itchy, scaly scalp, and he had a really successful hair transplant. It looks great.
It's
Yeah.
amazing.
That's good to know.
So, in general, because that hair cycle is 6 months, it does take a while to see the results. And
Sure.
I started to notice some improvement at around 4 to 6 months, but I will say it really took a year to see my final results.
The hair that was transplanted, does that fall out in the beginning?
Yeah, so it's interesting. Hair is dead. The hair that we all see,
It's kind of skeevy.
that's
when
it's dead. The actual follicle, that's where the magic happens. And so by transplanting that message, the little hair that's coming out, we shave it down to 1 millimeter basically. That hair, that 1 millimeter hair, will eventually fall out. And then there's that period of at around 4 weeks or so, you're like, oh my God, what have I done? I felt like my hair looks
Yeah.
worse.
Yeah.
Because and you can get what's called, shock loss in just doing the transplant. Some of the other hairs can fall out. And then you're like, oh my
it's a
gosh.
stressful
Did that happen
event.
to
Yeah,
you?
Yeah.
it is. And I did have a little bit of that, but to see to see everything kind of growing back, it's amazing. And now I'm just super happy. My hair looks great. It's full. It's thick. And I don't know. Would I do it again? 100%. absolutely. I think this was great. I don't think I need another one right now.
No.
My hair is like super, super thick, but I don't know, in 10 years or something, if I start to experience a little bit more, more loss, maybe I would consider it again. But it's been really great.
Do you think there's any benefit to doing microneedling PRF injections after getting a hair transplant?
Yeah, I
just
think
leave it
it's like one
alone?
of those things that kind of like supports the system and kind of gets it growing quicker.
Yeah,
Yeah.
the texts do recommend that patients receive at least one PRF
And
treatment.
you've been doing that
Yeah.
for our patients,
see them
after
as
treatments.
patients? Okay.
Yeah, I mean, I don't like to do it immediately after because, the scalp is still tender.
Totally.
You're still healing. Usually, give it a month or so and it's okay to do a PRF treatment.
Yeah, and we usually, because that can kind of like kickstart it, because you're getting those growth factors that are released from the PRF to kind of like help the hair grow. And yeah, I personally didn't do that, but we do it for a number of patients and people that want like everything to like get back to their normal hair the quickest. They're doing things like that.
Do you feel like there's still a stigma with men and getting hair transplants?
I think it's like it's becoming less and less. Like I just saw John Cena, I saw him at some event and I think it was like, what is he on the Oscars or something or the Emmys, and he had this like big spot and then he went because people noticed it so much.
Yeah, they just did it. He just did something about, I think it was like on Snapchat or it was like a whole article about how he had a hair transplant.
Yeah, so a friend of mine actually, he went to University of Michigan for his residency.
Go Blue.
And yes, and he is a facial plastic surgeon in Atlanta. He did John Cena's transplant. This guy only does hair restoration now. He's amazing.
Yeah.
And so I think
you're seeing more celebrities do it,
Yeah,
and it's becoming. And I think with
They normalize
social
it.
media,
Yeah.
it's so hard not to know. You notice, and more people are talking about it.
I mean, that's
so
true of facelifts. That's
Yeah.
true of plastic surgery in general. People are there's less gatekeeping going on
Yeah.
there. People are opening up about these things and they're normalizing it. Just in general, if you look at my Instagram, you're not going to see as many men than you're going to see women. So I think when there's a predominantly male procedure, it has been stigmatized more. But the more that men open up about this, I think it's going to be better and better for the hair restoration community.
I think a lot of the stigma comes from the fear of the unknown. And I think that's why there is a lot of stigma with the weight loss drugs too. Like going back to a previous episode we did, is people don't know what they don't know, and so there's this fear mongering, and so I'm here for it. Hair restoration.
I'm also seeing the trending, people going to Turkey. I just saw literally some
Oh, God.
blogger,
Yeah.
some husband. He's like, oh, I just got to Turkey to do my hair transplant. You're seeing a lot of people.
Yeah, I mean,
who was it? The Situation just said that he actually announced that he did his hair transplant. I know.
I mean, the thing about Turkey, and I don't tell anyone they can do whatever they want. It's definitely going to be cheaper. But to have a procedure in a foreign country where you don't speak the language is a little bit, it's a little bit scary. And I've seen, first of all, they'll do 5,000-6,000 grafts.
Yeah,
in
I mean,
one
we don't know the
sitting.
laws there. We don't know
what
their FDA is, whatever their version of
FDA,
the
they
yeah.
have no
What is
You're
the
just-
downside of doing 5,000-6,000 grafts?
You can over harvest the back. So
Okay.
then not only are you do this, but now you're going to see splotchy areas.
Yeah, you're
in
robbing
the back.
Peter to pay Paul at
Yeah,
that point.
And would your body reject it if it was too much?
No, but it can be if it's too tight. Then the grafts don't grow as well.
Yeah, okay.
You're just trying to push them into the same area. And you've seen those. They're just straight
looks-
across,
yeah.
right?
Yeah.
They're just they just put straight across. The whole
It's
artistry
art.
of it is to make it irregularly irregular. You know, you don't want it to look straight across. You want to mix it up a little bit so that it looks natural. The last thing I'll say is there are some things that are really exciting that are coming in the future. There's a company that I have personally invested in called Pelage, which is some really cool, it's actually a topical technology out of UCLA. And it has the ability to turn a follicle from a sleeping telogen phase to an anagen phase. And it doesn't matter how it got there. It could be from chemotherapy, it could be from, but like this is, there was just tons of articles about this. And it's in right now the end of their phase 2 trials, and they're moving to phase 3 trials. But things like, stem cells and cloning the hair, and, this is the future. So, I'm excited to see what's out there. Maybe we won't need hair transplantation in the future, but I felt like this was a safe and effective way for me. And right now it's great for our patients. But yeah, I don't know, 5-10 years, let's see what the future brings.
It's exciting.
Yeah. So with that, I will say thank you to all our listeners to this episode. We're always happy to have you guys listening to Beauty and Bloom, and stay listening, and we can't wait for you guys to hear the next episode.